Good afternoon, my friends. I am Dr. Firuza Parikh. I am the director of the Well Women Center at the Sir H.N. Reliance Foundation Hospital. With me, I have Dr. Trupti Mehta, who is a very senior consultant in IVF at the Well Women Center. Today, we are going to explore the topic of obesity. All of us, whether we are fat, we are thin, all of us think we are overweight. And therefore, Dr. Trupti, when we say somebody is obese, what exactly do we mean?
Okay, as per the World Health Organization, obesity is diagnosed as the accumulation of severe or abnormal amount of fat in the body, in the adipose tissue, to the extent that it starts impairing health. There is a simple calculation of the body mass index or the BMI, which is calculated based on the weight of a person in kilograms divided by the square meter of the height of the person in centimeters. So anybody who has a BMI of 25 and above is diagnosed as overweight, and anybody who has that of about more than 30 is diagnosed as obese.
So one can be mildly obese, moderately obese, or morbidly obese. Being morbidly obese is a medical condition and that needs to be tackled by specialists. Dr. Trupti, can you shed light on how obesity is created? What is it that triggers obesity? Starting from when the child is in the mother's womb to how the individual develops.
The causes of obesity are various. It starts developing in terms of the most important cause is usually a strong family history, environment and factors like the diet, wherein comprising of overeating or excessive consumption of the junk food with high calories, then inadequate physical activity because of lack of open spaces and uneven walkways, or whatever be the reason which prevents a person from going and putting in even 1 hour of a regular physical activity can be an important cause. Then exposure to endocrine disrupting chemicals, which are things which we are used to and are exposed to in our daily life, like soaps, shampoos, your plastic containers, paints, varnishes, pesticides used for vegetables, and so on and on. So these endocrine disrupting chemicals mimic and interfere with the hormones in our body, and they themselves cause an imbalance. And this imbalance basically results in a condition called as hyperinsulinemia, which is basically increased secretion of insulin. This is the main causative factor which results in many conditions, and most important, obesity. Other important factors are sleep deprivation, depression, certain use of medication like antihypertensives, antidepressants, antipsychotics, mood stabilizers, even some anti-epileptic drugs are known to cause weight gain. Then there are certain eating disorders like night binge eating and stress eating, which are usually have a psychological basis. And apart from that, environment and pollution also has a very strong link to obesity.
People who are obese in all phases of their life sometimes have a feeling of guilt or shame, and they are worried about how they look. It is very important not only to support them physically but also mentally, to give them the strength to say that, look, you are not alone, and obesity is something that we can fight together. So dear friends, please remember, you are not alone. There are a lot of ways your specialist can guide you as to how we can help you. Dr. Trupti, you did mention about obesity and some other disorders. Now, obesity is basically set off by inflammation in our body. So the trick here is to reduce the inflammation. There are many conditions which cause inflammation or which inflammation can cause. These are like diabetes, high blood pressure, neurodegenerative diseases. So there's a very strong link between obesity and other diseases. I think you have given a very good bird's eye view on obesity. Is there a final message that you would like to give our viewers?
Yeah, definitely. We all need to be aware of this condition, because there is the World Federation of Obesity has already estimated that within the next 12 to 15 years, half of the global population may be either overweight or obese. And if we do not take adequate measures, this can really cause a global impact even on the GDP, which could be comparable to that which was caused by COVID pandemic. So the most important message is to be aware and early detection, followed by intervention. Because if you know that there is a problem, there is a solution for it. So adequate activity, a balanced diet, which are extremely important to prevent obesity. And apart from that, certain endocrine disrupting chemicals exposures should be avoided.
Friends, my ultimate message to you is do not despair. Even if you are faced with the problem of obesity, come visit us at the Sir H.N. Reliance Foundation Hospital. We have many solutions and we are there to guide you through this difficult journey.